Good evening, everybody. I'm Dr. Madhusudhan, and I work as a pediatrician and a pediatric intensivist. That is an ICU. I look after the ICU at the Rainbow Children's Hospital here in Bannerghatta Road, Bangalore. And as you would know, I thought I'll share some of my what we know so far about this pandemic, and especially how to deal with children. So, you must have seen a lot on TV and read about in the papers. So, a pandemic is actually an infection which is spread over many countries and even continents. So, today we know that almost all continents in the world are affected by this pandemic. And you must have also heard that a pandemic has different stages, and we have already crossed probably the first two stages. The first stage being just that of imported cases when it first began in China and then spread to some other countries. The second stage being local transmission, that is, the people who came from abroad, their contacts got the infection, and fortunately, we have not yet reached a stage of widespread community transmission where it had spread in an uncontrolled fashion. That has not yet happened. And you must have also heard a lot about all the precautions that we need to take, and I'm sure most of you must be taking it already. And so the most important thing that probably we have accomplished or like in the right direction today is in trying to flatten the curve. So that is the most important thing. And I'm sure you are all following social distancing and all the personal precautions like hand washing, using hand rubs, respiratory etiquette, masks, and all the precautions to take while going out. So I'll we can, today the topic is more about how to apply all these in children, because in adults it is much more easier than in children, and especially a child can be anything right from 1 day old child to let's say 14 years, 15 years, teenagers who are more like adults. So especially in younger children, it may not be very easy to apply all these follow all these precautions. I'll tell you about some simple things which we can all do at home. So, regarding the same personal protective measures which I just told, hand washing, I'm sure you all know how to follow hand washing at home. It is said, it is recommended that we wash our hands repeatedly, just with the soap and water that we normally use at home, at least every time for at least 20 seconds. So, at least like I'm sure from toddlers and preschoolers till teenagers, it becomes our responsibility to ensure that they wash their hands regularly. And hand rubs, especially, we should be careful when we are keeping them in the presence of younger children, because if accidentally ingested, it can be very dangerous. So it is very important that we keep hand rubs out of reach of smaller children, and only older children are allowed to use them the way they are supposed to be used. So I'm sure you all know this, that when we are using hand rubs, we put a palmful of the hand rub, and then the same way that we wash our hands in the same step. So first palm to palm, then right on left and left on right, and then the back of fingers, and then the thumbs, each thumb of both hands, and then the fingers on the palm. So these are the different steps that we follow either when we wash our hands or when we use a hand rub. So this is about hand washing and hand rubs when we are using them in children. And respiratory etiquette, I'm sure you all know that we are supposed to use tissue papers or handkerchiefs when we are coughing or sneezing. And if we have nothing in our hands, rather than coughing like this, we are supposed to bend our elbow on the mouth and the nose and then cough into that. So that is again to limit the infection. So social distancing is nothing but another powerful technique which can control the spread of infection. So we have to ensure a distance of at least 1 meter, that is 3 feet, between any two individuals, whether at home or whether whenever we go out for any essential work that we have. So the importance of social distancing is, you all know that how the virus spreads. So one way is by droplet infection. That is, whenever we cough or sneeze, hundreds and thousands of droplets are released from our mouth and nose, which can travel a maximum distance. Most of them travel is 2 meters, that is 6 feet. So at least, if not 2 meters, at least 1 meter distance we have to maintain between any two individuals. So that is called social distancing. So, especially at home, it becomes important because we know that the elderly are more at risk of severe infection and severe disease, and young children are more often likely to be without any symptoms, even if they have the infection. So, they are more they can spread the infection to others. So, it is especially important to ensure social distancing between children and the older people at home. So, as you all know, like childhood is a very special phase of life and a very dynamic phase in that it keeps changing. So, you must have seen those of you who have small kids. Kids keep changing every few months. The way they look, talk, speak, behave, everything keeps changing, and these changes are very dramatic in the first few years. That is why children are so special, and I'm sure you must have realized by now when we are all staying at home and working from home that it is not easy to deal with kids, especially when we have two or three kids at home and they are not going to school like they used to do. It may be a tough task to manage them. So I'll just brief you on some basic things of how we can ensure that we become effective parents, and all the children can also go through this period of lockdown effectively without any major impact on their childhood. So that is important. So we can discuss this in 5 dimensions. So every child, every development has 5 dimensions. It can be physical, social, intellectual, emotional, and last but not the least, spiritual. So these are the 5 dimensions on which we can work, not just during the COVID pandemic, it becomes especially important now, but even otherwise when we are dealing with children. So the physical component consists of the same basic components like diet, sleep, physical activity, and any illness if any. So diet, all this is important in this phase because it is very important that we keep ourselves fit, our children fit, and our immune systems robust so that in case we do contract the infection, our bodies are strong enough to fight the infection. So that is the importance of all this. So diet, there is no specific restrictions or recommendations on diet, but overall it has to be a healthy home-based diet. So now at least let's hope that all the junk food has come down because of the lockdown, and it has to be a balanced diet where it has the right mix of the cereals, proteins, vitamins and minerals, and yes, lots of water whole day. So this is something very important, to drink lots of water the whole day. And it is also important to keep usually a regular schedule because with everybody staying at home and it is like a holiday, and the entire schedule of the day can go haywire. So it is important to avoid that, and especially with the meal timings, it has to be constant. So as they used to have when they used to go to school, you should keep the same timings throughout the day. So that is something which is important. Second thing is ensuring adequate physical activity, which can be very challenging because all the parks and the playgrounds are closed and we are all staying at home. So as far as possible, within the house or just like outside the house in the compound or in the terrace, you can, in your own creative ways, plan different types of physical activity depending on the age of your child. And yes, one very useful uh, activity in this time will be yoga, which does not need us to go out at all. So just by staying at home, we can keep ourselves and our children. All the older children, I'm sure many of them must be learning yoga at school also. That can be a very effective technique to keep ourselves fit at this time. And the third very important thing is to get good sleep. So this is one thing that can really suffer at this time when our schedules can go haywire. So it is very important that younger children get somewhere between 8 to 10 hours of sleep a day, and the older children also get at least 8 hours of uninterrupted sleep. So that is important. It has to be an uninterrupted sleep. So to sleep on time and to wake up on time so that they get the required duration of sleep. So sleep has affects on almost every system of the body, even including the immune system. So it is very important to get good sleep. And another major thing that can hamper sleep is the use of media. It can be TV or it can be any of the social media. It is a recommendation to be effectively followed that at least for a period of 1 hour before sleep, we should not come in contact with any of the media that can hamper sleep. So that is a known thing, and that is where it is very good if we can follow all that, and especially for the children also. So this is the physical component, and in case any child at any time during this period gets sick, so it can be just a fever, cough, cold, any symptom. So it is best to consult your doctor. So all the major hospitals are functioning, that you know. But the nearby clinics may not be available, but all the major hospitals have teleconsultation facilities. And yes, if there is any major problem, you can directly go to the hospital anytime. So don't get scared that whether it is COVID or not COVID, it can just be a common cold. So we know that coronavirus is just many of the other viruses that causes common cold, and coronavirus was there for many years before this current pandemic. So it is nothing to be worried about. It is best to contact your doctor, and depending on what he or she suggests, you can go for if testing if it is required. So it is very important to not stay at home when there is any doubt about any illness. And the second component after the so far we discussed the physical component of caring for children at home. The second component is the social component. Social component, one major boon during this time has been that we are all getting more family time because of the pandemic. So that I'm sure you all agree. So that is a major advantage now. Whether it is eating, playing, sleeping, or any kind of activity, it is much more fun to do it together, and this has a direct impact on the development of the child well. And here again, it is probably naturally just with this pandemic, the use of screen time and media usage must have gone up. But it is very important again to set limits so that it doesn't exceed the limit. And all the children would also enjoy if you can get in touch. If they get in touch with the relatives that they used to love and come in contact with more often, now you can use all the uh, video calling or all the technology can be used so that it can stay in touch, whether it is grandparents or whomever they miss. So that is an important part to stay connected even in this time. The third component of child development is the intellectual part. So older children all go to schools or colleges, and they must be having online classes. But it is the younger ones who it is very important that we take care of their continuing development. So two things I would like to say here, which have a powerful impact on development of young children. One is storytelling. It has seen to have a long term and a very strong impact on the way children think and develop. So storytelling, especially at bedtime. And the second thing, you must have seen that especially young children, once they start speaking, they have so many questions. They are curious about so many things that is happening around them. It is very important to encourage questions and to heed to those questions and to answer them so that their development goes on unhindered. So these are some of the things that I wanted to share with you. And the next aspect is the emotional aspect of development. So emotional aspect, especially at this time, especially with the older children, some of them may be under some kind of stress. It is very important that as parents that we know how to recognize stress in different age groups of children. So, and different age group of children may behave or respond to this stressful time in different ways. So it can be, it can affect their diet, their appetite, their sleep, their activity, their mood, their behavior, so many things. So you, as parents, you just need to be sharp enough to pick these clues that whether your child is under any kind of stress by noticing any changes in any of these daily routines. And some kids may respond by becoming more irritable, more cranky, crying, becoming angry. So, as parents, it is important that you recognize these signs, try to get to the cause of why this is happening, and then try to correct it. And yes, again, it is important that other than probably some restricted time, which we can earmark for the news and all the unpleasant things that keeps coming on TV. So it is important to avoid this having this whole day, because again, it creates a kind of a negative and a fearful environment at home, rather than a more positive environment which is required now. So, as has been repeatedly emphasized, that there is no need to panic even now. There is no need to panic. It is important that we keep ourselves well informed and don't sit in front of the same COVID news the whole day. So, let us keep the home environment quite positive and quite healthy in that sense. And the last dimension is the spiritual dimension. So this is even for even younger children, it has been seen that all the spiritual practices can have a positive impact. So and they can prove to be very useful, especially at this time. So whatever religion we belong to, prayer is a very powerful tool, especially when as a family we sit and pray. It can be a very powerful tool to create more positive vibes in our homes. So this is something very important, prayer and meditation. So even possibly school going children, you can encourage them to get into prayer and meditation. And as such, when we practice it together, it can have a very powerful impact, especially at this time. So these are the five different components on which I just wanted to share what we know, and some specific scenarios. Like some of you may be having newborn babies at home, so this is a very challenging time to give birth to a newborn and to take care of the newborn. So, and like any other newborn, you must be facing a lot of problems. So, breastfeeding is something which should go on unhindered, because none of even those mothers who are suffering from COVID-19, there is no contraindication. So it is not reason to stop breastfeeding, even in those mothers who are positive, it is seen. So unless provided they can maintain the safe precautions. So as such, for mothers in general who are in the community, breastfeeding is something which is a must, because it is something which will actually help the newborn baby to acquire its immunity. So breastfeeding should go on without any restrictions because of COVID. Second, another problem commonly which we see is many newborns cry a lot. So crying is a part of normal behavior of the baby, and most of the times it responds to simple soothing techniques, whether it can be just carrying the baby, singing to the baby, rocking the baby, feeding the baby, and sometimes just leaving the baby alone if nothing works. It is just a time limited thing. So crying is part of a normal behavior, and especially new mothers can get in touch with other new mothers at this time, also with your gynecologists and pediatricians, to seek help if you have any specific problem. And even for all the younger children, so for example, who are a few months old now, it is a good time to talk to them, sing to them, and spend some positive time with them. So it is important for all this that you yourself are not stressed out. So it is very important that mothers take care of their own diet, rest, and sleep, so that they can be in their best form to take care of their children. And definitely fathers will need to play a larger role, and many times it is important that parents take turns in managing children, because that is very important. Another important issue is immunization. So all hospitals must have started immunization now, especially the primary series of vaccines. The ones at birth are given even before the baby is discharged, so that is fine. The primary series, which starts at 6 weeks, that is 1.5 months, 1.5 months, 2.5 months, and 3.5 months. So these three are something which should not be delayed for a long time. So vaccines are being given in all the hospitals. It is important that all the babies get the primary series of vaccine without any interruption, and the one at 9 months of age, the measles MMR vaccine at 9 months of age. So these are some important vaccines which should not go missed because of the pandemic, because they have their own dangers. But the later ones, so something which is coming at 2 years or 1.5 years, can probably be delayed by a few weeks. But again, it is best to get in touch with your pediatrician if you have any doubt. So that was another thing which I wanted to say. The third thing that parents often keep complaining is behavioral problems. So children have a lot of behavioral, in fact, you can't call them problems because they are a part of normal growth and development. So many kids may be throwing tantrums at this time. So it is very important as parents that we play a positive role in the way we handle these problems. So most of the times you must have seen that when we direct their energies in a positive direction, in a positive way, their aggression and all the negative behavioral traits are controlled automatically. So it is very important that we give them something to do, keep them busy, keep them active, and keep them creative. So this is something which will redirect their energies in a positive way and prevent all their behavioral issues from surfacing. And yes, again, use positive reinforcement. Positive reinforcement means praising the child when he's doing something good, or giving him a small reward when he's doing something good. But when he does something which is not good, or something which is not expected, it is best to ignore it rather than repeatedly scolding him, and especially hitting. So hitting is something which is completely forbidden nowadays. So corporal punishment, whether at school or at home, is a thing of the past, because not only does it not have any use in controlling child's behavior, but also it can have harmful effects on the long term. And especially at the time of a pandemic, when children are seeking more reassurance and more support from the parents, it's very important that we create that kind of environment at home rather than repeatedly scolding or physically punishing them. So it is very tactfully we have to handle this situation. And another important technique that is used is called timeout. So in case a young child, is repeatedly cranky, demanding something, or showing unfavorable behavior which you had forbidden, so do something called as timeout, where we just ignore that behavior and don't speak to that child for a defined amount of time. So which can be the number of the same age number as so many minutes. So that is what we take as the duration of timeout, and then after the timeout is over, we start behaving normally with the child. So the child understands that this behavior of me is not being liked by my mother or father, in a silent way rather than in a more aggressive way. So so these are some of the things I wanted to share with you. And another thing which parents ask is about the screen time. So again, media, like many other things in our lives, can be used in a good way or in a bad way. It's up to us. It is very important we restrict media usage, whether it is television, phones, Facebook, WhatsApp, whatever. So there has to be a restriction in terms of time, and we can also use that in a more positive way. The parents use the technology together with the child to actually strengthen his development and learning rather than in a negative way. So it is something which cannot be totally avoided, but it is in our hands whether we make good use of it or not. Okay, so these are some of the things which I wanted to share with you. So, the main thing about the lockdown, or about the COVID pandemic, is that as of now, we don't know for how long this will continue. So, I'm sure it has dramatically changed the way we live in so many ways, and many of those ways are actually positive. So, many things which we could not achieve in our normal lives before the pandemic, we are able to do it now. And it is very important that all these good things we continue doing them. And as for the pandemic, nobody knows how long it lasts. So all the good behavior that we have learned in this time, so whether it can be simple hygiene precautions that we are all taking, like hand washing, hand rub, social distancing, or all the family time and the creative things that we are doing, these are some of the things which we should make it permanent in our lives and practice on a regular basis. So let us use the pandemic that way in a good sense for the good of all of us. Uh, if in case you have any questions, you can uh, type them here so that I can go through. Another important thing, this is not just for children, but important for adults also, that one major negative impact of the pandemic has been that it completely disrupts our usual day-to-day schedule. So, this in fact has an effect on all the five components which I just spoke, that is the physical, social, intellectual, emotional, and the spiritual aspects of our life, is to maintain a regular schedule. So this is something which can easily go haywire. Even otherwise, before the pandemic, like many of our Sundays are much different from the usual weekdays. We end up getting late and getting up late and having food at a very erratic time. That is something which has to be avoided. So one thing which can solve many problems is to have a regular schedule. So it can be the time at which we get up, breakfast, lunchtime, time for activity, time for rest, sleep. All this has to be in a regular schedule. It need not be a very strictly enforced fixed schedule. It is need not be something very predictive so that the children get bored of it, but it has to be something flexible also. So it is important that we have a predictable but fixed schedule. Sorry, but flexible schedule, so that we don't go haywire in these. This is a very important thing for all of us to do. So I think one of you has a question. Yeah. So one of you has asked a question who has a 28-day-old baby girl who's grunting and crying before peeing and pooping. Yeah, so as I said, small babies cry for a lot of reasons, especially probably the first 1 month is more or less okay, but somewhere between 2 to 3 weeks of life, or one to 1.5 months, many babies start crying more, and this crying can persist up to anywhere between 3 to 4 months or 6 months of life. So, in medical terms, we call it infantile colic because their intestines are maturing, and as nobody knows the exact reason why it happens, but it is something which is part of normal behavior of young children. So, children can cry for a lot of reasons. Babies can cry for a lot of reasons. They can be hungry, or might have wet their diapers, or just before passing urine or stool, they can cry. After passing, when their diapers are wet, they can cry, or they may cry just for seeking their mothers to hold them close, just for reassurance. So many reasons are there for a baby to cry. So as long as small babies are feeding well, that is every 2 to 3 hours, they are attaching to the breast well and accepting breastfeeds well, passing urine and stool normally, and they are active when they are awake, and they sleep well. So when all these are there, there usually will not be any reason to worry. So crying before peeping and pooping is peeing and pooping, sorry, is normal as for small babies. So I don't think you need to worry as long as there are no other danger signs which I just told you. Okay, there's another question. Can you advise on vaccination of a 2-year-old kid which is due? Can we postpone till lockdown? Uplift. Yeah, so 2 years usually we have all the optional vaccines. So as you all know, some vaccines are mandatory. So many of these, all these mandatory vaccines are the ones which the government of India supplies free of cost in all government hospitals, and all the other vaccines are the optional vaccines. That is, yes, they are required, but since they have to be bought rather than being available free, it is left to the parents. So as long as they can afford to buy it, they should go ahead and buy it and give the vaccines. So 2 years vaccines will usually be either the typhoid one, or the chickenpox one, or the viral hepatitis one. So all these vaccines, by uh, even if you postpone them by 4 to 6 weeks, it is quite okay. So for a 2-year-old kid who has to get his optional vaccines, it is okay to postpone them for 4 to 6 weeks. But for very young babies who have to have their primary vaccination, That is the ones which come at 1.5, 2.5, and 3.5 months of age. And the 9 months vaccine, it is better not to postpone them long, and it is better to get them during the lockdown also. And there's another question which says, is multivitamin necessary for kids as we have not yet started taking anything yet? So multivitamin is in the sense, usually for the first year of life, that is the first 1 year of life, vitamin D is one thing which can be given for all kids. So this is one thing which is recommended. So multivitamins actually means one is vitamin D and calcium. Vitamin D has to be given, is usually given for all kids till they are 1 year of age. And the other multivitamins, so it can be B complex vitamins or it can be iron and folate. So these are some of the syrups that are available. It is not a routine recommendation to be given to all kids. So if your doctor feels that the child is deficient or at risk of deficiency, he may prescribe it. But as a routine, it is not required for all babies, those who are born at term. So, but those babies who are born much before their due date, those who are premature, preterm, they are given all the supplements till they are 1 year of life, including vitamin D. But for otherwise healthy term babies, other than vitamin D, no other supplements would be required as such. This is because it is more important for us to concentrate on their diet and to ensure that all the vitamins and minerals are provided as part of their diet rather than taking separate syrups. So for healthy kids, other than vitamin D in the first year of life, no other supplements are usually required. There is another question. I have a 3-year-old boy who's very angry and crying nowadays inside home. Please advise how to control. So, as I told you, many of the kids may be behaving cranky nowadays. So, as adults, we have to understand that their usual routine is lost. They are no longer able to go out with their friends to play in the parks and the playground. And even for older kids, they're out of touch with their friends at school. And many of the pleasurable activities which they usually indulged in are all, most of them must have been out of bounds now. So, it is a natural reaction for them to respond like this, and different ages of kids may respond in different ways. So, as I said, it is important that many times what happens is we adults get busy in our usual day-to-day work, and children are end up with nothing to do, especially when they are alone. They may just get bored. So, most of the time, that is the commonest reason why children throw up tantrums. So it is very important that, as I told you, to plan their day, have a structured program in terms of their meal times, activity, and sleep, and to restrict social media usage. All these are important in controlling negative behavior in children. And don't scold or use any physical punishment for any kid, irrespective of whatever age he or she is. And it is very important that we direct their energies in a particular way. So those kids who are physically active in the day and eat at proper times will get a good sleep at the right time. So it is very important that we redirect their energy, and again, it is left to our creativity. So what all we can devise at home. So to keep the child busy and to use positive reinforcement techniques. To a large extent, many of these behavioral issues are something which are part of normal childhood. So unless it is really like getting out of control where you may need to see a doctor, otherwise it is usually part of a normal childhood. So another question which says, what should we include in diet for an 8-month-old baby? So usually we start feeds which are called complementary feeds, because till 6 months it is only breastfeeding. That is what is advisable. For the first 6 months of life, it is very important that every child is exclusively breastfed, unless there is some health issues with the mother or some other issues with the baby. The usual recommendation is exclusive breastfeeding for 6 months. Between 5 to 6 months of age, you can start giving additional foods, that is called complementary foods. And what you have to ensure is it need not be any branded food item which is available in the market, like Cerelac or anything like that. Best is to give what you prepare at home, depending on whatever you usually eat. So it is most important that the consistency is right for the child. For example, a 5 to 6 month old child would not have developed teeth yet. So the consistency has to be either liquid or a semi-solid with no particulate matter or chops of food material in the feed that we give. So you can start with a mix of cereals or pulses or even dry fruits or jaggery. All of them can be powdered, and in different combinations, you can make a pasty consistency food items. You can make it either with water or with the formula milk if you're using that. Usually, we avoid giving cow milk till 1 year of age because they are more likely to become allergic to it. So till 1 year, we avoid giving cow milk. But with any of it can be rice, wheat, ragi, jaggery, or any of the grams. They can just be fried or powdered and then mixed into what is called as ragi ganji, akki ganji, and or the ragi seri, all these, or even khichdi. So 8 months they may be able to have mashed bananas and vegetables and fruits. Vegetables you can boil them and mash them and give. Fruits also you can boil, mash them and give, especially like banana you can give. So make sure that you're when you're introducing newer food items, introduce one at a time and see whether your child likes it and wants more of it or not for a few days, and then think of whether to add another one or continue with the same one. So that is how we usually go. And yes, this is a very crucial time, 6 months to 1 year. The more food items that you introduce at 6 months to 1 year, the less cranky they will become later on. So many parents commonly complain that ये नहीं खाता वो नहीं खाता कुछ भी नहीं खाता and all that. So all these problems possibly have the root causes in that 6 months to 1 year of age, where it is very important to patiently feed a child, understand his taste and behavior, and to introduce as many food items as possible in the correct consistency and amount. Okay, there's another question which says, can we give all fruits or any selected for 2 years? 2-year-old kids can have everything that normally adults have, and the only thing that we have to be careful is nuts, ground nuts, or any other dry fruits, because kids are they keep talking, crying, and laughing simultaneously when they are eating. So there is a risk of choking. So other than the hard nut-like items which come, the rest there is no restrictions. A 2-year-old should be eating all vegetables and fruits without any restriction. Normal family diet, whatever adults have. Our 12-year-old daughter, she gets to fear. How would we overcome her fear? So probably you need to first find out what is she getting scared of, for how long is she scared, and what is she getting scared of. Some children also are very variable in their behavior. Some may be very extroverted, some may be very silent and introverted. So this is a very like broad term to say that she has a fear. Like whoever of you is more close to her, either the mother or the father, you can just sit with her and speak to her probably on what she's getting scared of. Is it related to this pandemic? Is she getting scared that she's missing her studies, her school friends, or she's just getting bored and stressed at this time? Again, just make sure that she's not getting too much involved in with social media or watch screen time, or just with the same repeated negative and scary COVID news all the time. So and ensure that she is on a good diet and getting good sleep. So all these we'll have to look into. So first, like look into why she is scared, and then we can think of solving it. As I said, the sources of stress in school-going children can be either at home or in school with friends, teachers. They may be scared about their studies or about this pandemic in general. So many things. So we need to find out why she is scared first. There's another question. 28-day-old baby has a big bald head patch with no hair on top, like in adults. Yeah, like I think 28 days is too small an age to like usually hair growth keeps happening continuously in the first 1 year of life, so I don't think you need to worry about it. But if it is a patch with absolutely no hair, or even not even dots of hair, follicles are also not visible. If there is any patch of completely without hair or without even hair follicles, you may visit a doctor, but again, it is not an emergency, not during the pandemic. Or if you know any doctor, you can just take a pic and send him and ask him if anything needs to be done. But even if it may be something completely normal, in case if there is some issue, also it is definitely not an emergency. So probably you can get in touch with your doctor later on. I have a 5-year-old daughter. How much milk quantity should I give to her in a day? So yeah, this is another like very Indian kind of a phenomenon. There are so many jokes around this that all the mother keeps saying is "doodh piyo, doodh piyo." So yes, milk is important. It has a lot of nutrients. And one before I come to your question, I would just stress on this that usually what happens is, especially at the 6 months to 1 year of age, there are many kids we have seen who take predominantly cow milk, and so even between as they grow older, say they're 1.5 years, 2 years, so their diet has um, majority of their diet is just milk. That is something not favorable at all because one, it deprives their appetite to have the normal solid food, which has so many nutrients in it. So it can be roti, dal, chawal, all the vegetables, fruits. So they don't get an appetite for it because their appetite is easily quenched by just drinking milk. The second thing is milk itself is deficient in so many things, especially iron. And it is also said that milk, because it is cow milk, it is not human milk. When cow milk goes inside a human being, especially in the first year of life, there is a chance that it can cause an allergic reaction in the intestines. And all these reasons may predispose a child to develop anemia, that is, a low hemoglobin. So it is important that milk does 2 to 3 times a day is fine, but milk should not form a predominant part of anybody's diet. It is more important that we stress on giving them solids and semi-solids. All the older kids should be eating like adults, and milk is just 2 to 3 times a day. That is fine. Any other questions? Yeah, I think I've answered most of them. Yeah, okay. Okay, so thank you all for giving me an opportunity to share whatever we know so far about the pandemic and how to deal with children. It is a very tough time. It's not easy to stay at home and manage kids, even though both the mother and the father may be staying at home. And especially when both need to work from home, it may become even more tough. And especially we may not have readily accessible sources of help like grandparents, or it's not easy for anybody to travel at this time also. It is a very challenging time, but just by sticking to the basics, which I referred to in my talk, it is important to have a good schedule, and it is important that we prepare ourselves for a longer phase. That's what was coming in the news also today, that there is a chance that the lockdown might get extended, and it is very important that whatever good we have learned during this time, it is important that we carry on with that, and irrespective of whether the lockdown opens or not, all the precautions that we are taking every day, it is important that we continue, and the children will just do whatever we are doing. So even small kids, it is seen that they just observe what adults do and they silently imitate us. It is very important that we ourselves behave as good and responsible citizens. Another question, sorry. One more question, please. Can I give egg to my 8-month-old baby? Yeah, I think you can. If you, as a family, if you have eggs, yes, you can give your 8-month-old. Do you usually like egg is also like milk? It is, since it is an animal product. There is a chance that it may cause allergies in some kids. So, if possible, you can withhold till 1 year. But otherwise, there is no absolute contraindication that it should not be given. But like milk, it is you can withhold it till 1 year of age. Otherwise, it is best that kids get used to whatever the usual dietary pattern that is followed at home. That is the best thing for all kids. So thank you all so much. Before I end let me say that it is very important to be good role models to our children, and not just with the bookish knowledge, but it is very important to equip ourselves and our children with life skills, because that is what will stay with them for life. So thank you all. With this, let us end the session today. If you have any doubt, you can just contact the Rainbow Hospital number, which is there on the website. My name is Dr. Madhusudhan. I'll be happy to answer any of your queries at any time, any day. So you can just go to the website and take the number. Whether it is a daily consultation or just a query, you can just give us a call. So we are there to help you anytime. Thank you so much. Thank you.